how many of you have found it a little bit difficult to convince your little one to participate in tummy time? My guess is probably most of you. Since our babies now sleep on their backs, they're not as accustomed to being on their tummies as they once were. So I'd like to show you some ways that you can make tummy time a little bit easier for both yourself and your baby. I often get asked, at what age can you start tummy time? The answer is right from the word go. Many people do this naturally, not even realizing that it's tummy time, when they practice skin to skin bonding and immediate chest to chest bonding to help initiate breastfeeding. Here we have Andrea and Kara at just 4 days old, demonstrating just how well newborns can do with tummy time.
Where's that head? Let me see your eyes. Show me your eyes. Oh, beautiful. Beautiful.
That chest to chest position can continue to be used for tummy time all the way until you are laying flat on your back and your baby's on top of you, can crawl right off of you if they want. The key when using that chest to chest position for tummy time is to make sure that as your baby gets stronger and gains a little bit more ability to lift their head up and eventually their chest up, you want to make sure that you are gradually reclining your body further and further to make it harder for them. Prop yourself up in a nice chair, on the bed, get that chest to chest position, and get started with tummy time right from that word go. Another really nice way to introduce tummy time with a young baby is by carrying your baby on their tummy, stretched out over your arm and supported from underneath. This position allows your baby to start to develop control of the neck muscles and their upper back muscles that will help them when you do tummy time on the floor. But it also lets them feel supported. You can move, you can sway, and it's a great position for stretching your baby out if they're gassy. Now, the important thing is to make sure that you spend some time over both arms so that if your baby does have that preference to look in one direction or the other, they're stimulated to go to both sides. Another nice position for doing tummy time is with your baby draped across your lap. They feel nice and close to you, you have good support of them, and it allows you to help stabilize their pelvis, helping them use the muscles on their back. You can even drop one leg to bring your baby up into a nice incline where they then don't have to work as hard against gravity. Again, just like carrying your baby on their tummy, make sure that you spend some time in either direction so that your baby is stimulated to look to both sides. Another great option for tummy time with a slightly older baby, generally starting around 3 months of age, is to use an exercise ball. This allows you to add a little bit of rocking and movement to tummy time, which often makes babies a little bit happier. It's a fantastic option if you have a full-length mirror that you can place the ball in front of so that when you go forward, your baby can look up and interact with themselves in the mirror. It really is a great way to get some tummy time in. And even though we're not right down on the floor, your baby's still developing the muscles in their neck and back that are going to help them when it does come time to get down on the floor. So our last position for tummy time is what we think of as classical tummy time, or being right down on the floor. Many people are afraid to put their newborns down on the floor on their tummies, but your baby might surprise you. And as long as you are using this as an awake, supervised play position, you are perfectly okay to put your baby down on their tummy at any age. If your baby has a preference to look mostly in one direction or the other, you can use this position to stimulate them to look to the side that they don't prefer to go to, which will also aid in your repositioning and counter pressure efforts to get that flat area to fill in. As your baby starts trying to lift their head up against gravity, many babies get frustrated in this position because their heads are so big relative to the rest of their body that so much weight is resting on their head and their shoulders. You can make this a little bit easier for them by creating a roll or a pillow out of a towel or blanket, placing it across your baby's nipple line, right under their armpits, so that they are brought into a nice incline where they can then more easily lift their head and look around and interact with the environment. There are lots of pillows on the market for tummy time, but the nice thing about making your own roll with a towel or blanket is that you can make it just the right size for what your baby needs. By the time your baby is about 3 to 4 months of age, we like to try and transition them away from those rolled up towels and blankets so that they really get the sensation of pushing through their arms to help lift themselves up. And we do like to see them doing the majority of their tummy time right down flat on the floor, ideally 3 to 4 times a day by the time they are 3 to 4 months of age. Hopefully you have found these tips and tricks helpful and will be able to use them to increase your baby's participation in tummy time. It is recommended that you start when your baby is a newborn with a few minutes at a time, working up to a combined total of at least 1 hour per day by the time your baby is 3 to 4 months old. As your baby gets stronger, you can incorporate things like airplane rides, either on your legs or by holding your baby in the air slightly above you. Even if tummy time is not your baby's favorite activity, the more you manage to do it, the stronger they will get and the more they will enjoy it. Just remember that those early initial grunts and fusses are just your baby's way of telling you that they are working hard. Tummy time has many benefits for your baby, including developing strength in the neck, shoulder, back, and abdominal muscles to help gross motor development for skills such as rolling, sitting, crawling, and walking, and developing strength in the hands for fine motor skills such as manipulating toys, self-feeding, and even handwriting when they are older. Helping to avoid or correct flat areas on your baby's head, as discussed in Chapter 1, avoiding or helping to correct torticollis, which is a tightening of the neck muscles, as discussed in Chapter 2, facilitating visual development, as your face or their toys are generally very close to them, directly in their line of vision, giving them more experience with focusing and tracking, as well as developing depth perception. Developing sensory skills as they experience the texture of the carpet, floor, blanket, or even grass against a large portion of their skin and the palms of their hands. Stretching the hip flexor muscles for pelvic symmetry, as tummy time is sometimes the only time of the day when baby's legs are stretched out fully. This is important for future crawling and walking. Providing pressure on the tummy to aid in digestion and gassiness and help with constipation, and fostering overall cognitive development. If you are in the Calgary area and would like assistance with tummy time, or if you are worried that your baby may have a flat area on their head or torticollis, infant physiotherapists are available at Milestones Physical Therapy Services, Lakeview Physiotherapy and Acupuncture, Calgary Youth Physiotherapy, and Vita Health and Wellness. Due to COVID-19, all of these providers are currently offering therapy assessment and treatment via telehealth. Thanks for tuning in, and please stay tuned for Chapter 5 on sleep, helmets, and additional considerations.